A report from the Commonwealth Fund, released in September 2024, focused on the quality of healthcare in 10 developed nations: Australia, Canada, France, Germany, the Netherlands, New Zealand, Sweden, Switzerland, the United Kingdom, and the United States. And the United States ranked as the very worst on the list.
The study looked at a range of factors: access to care, care process, administrative efficiency, equity, and health outcomes. Access to care has to do not just with availability, but with affordability, and the United States ranked last on this factor, largely because of its extremely high cost of care.
On equity, that is, guaranteeing quality treatment for everyone, regardless of gender, income, or geographic location, we ranked ninth. We also ranked ninth in administrative efficiency, with only Switzerland being worse than us in this area.
Dr. Joseph Bettencourt, the president of the Commonwealth Fund, said that no other country in the world expects patients and families to pay as much out of pocket for essential healthcare as they do in the US. He also noted that the United States is undersupplied, which is why patients here have to wait so long for specialty care and many can't find a primary care physician.
Recently, of course, the national conversation has focused on healthcare because of the government shutdown.
For many Americans, the shutdown raised an urgent question. What does a just healthcare system actually look like? Is it one where access is tied to employment? One where the poorest people rely on a patchwork of emergency rooms and clinics for care? Or is this an opportunity to imagine something different, a system built around dignity, equity, and the common good? And might our church have some resources to help us get there? That's what we're going to talk about today. I'm glad you asked.
Welcome to Glad You Asked, where we answer the questions about Catholicism that are easy to ask, but not so easy to answer.
Hey, Rebecca, how are you?
I'm doing all right. I'm very invested in this conversation today. It's something I feel strongly about, so perhaps I'll have to restrain myself from getting too worked up. How are you?
I don't know. Well, I don't know how to answer. How am I? But I think that one of the things that I've come to realize, and I think we all have come to realize fairly recently in this discussion around healthcare access and insurance, is really how much we all depend on healthcare and subsidized healthcare, regardless of whether or not we have our own health insurance. You know, I think both you and I are fairly lucky in our health insurance situations at the moment, but we all have family members or just like the care that is available to us that really relies on everyone having access, and that is really at risk. And so, yeah, I think this is a really important topic, and I'm really glad that we're talking about it today.
Yeah, I lived many years without health insurance as a kid and then later on, and it was just kind of like, well, gotta hope you don't get injured. And when I was younger, when you're in your early 20s, you're immortal. Nothing can harm you. But then you start getting a little older and you start thinking, oh, I can't do this, can't do that. And I'd started to really, it was kind of this overarching concern. Well, what if I get sick? What if I get injured? Then you have children and your children aren't insured, and that adds a whole other level of anxiety to it. And so I've been very kind of feeling on a really visceral level what so many people must be experiencing. And I've been lucky because my family's, knock on wood, been fairly healthy. And I think about people who are caring for children who have chronic illnesses, people who have experienced really devastating injuries, and just how terrifying it must be for them to think about losing their health care, or even honestly to think about something bad happening with the expensive health care that they already have.
My father-in-law is in a nursing home and has a variety of conditions that mean that he needs a lot of support. And so there's not a lot of nursing homes that have the resources, especially where he lives in rural Michigan, that have the resources that he needs to make sure he is properly cared for. And when he went to the nursing home, he had to go on Medicare, which was anyone who's ever been involved in that system knows that there's a whole bunch of hoops you have to jump through. And meanwhile, the nursing home is holding a spot for him. Not all nursing homes take Medicare. Both him and my mother-in-law had to jump through all these hoops with their finances and their house and how they organized all these things, right? And then when now there's been talk about changing the qualifications for Medicare or defunding Medicare, and the question becomes what happens not only to him, because he could lose his spot in the nursing home if he doesn't have Medicare insurance to pay for it, but if the nursing home doesn't have Medicare patients paying the bills, can they afford then to exist at all? So it's not only a question of access for the people who rely on Medicare to care for their own care, but it also affects all these other people who might be paying with private insurance or out of pocket, whose then bills will skyrocket if there's not these other patients helping to support the nursing home as a whole. And so it is this a really terrifying thing. It really is a big issue.
And I keep thinking, where are we going to be 10 years from now, 20 years from now? How many, if this system continues to be in place, I don't see it being sustainable. If by sustainable we mean, maintaining anything remotely like a acceptable quality of life for the ordinary working person in America. It's pretty anxiety inducing, and it's actually pretty enraging as well.
And is there a possibility to envision something different? Or are we just stuck in the system? Is it so broken there is no hope for it? That's what we're going to talk about today. I'm Emily Santa, one of the hosts of Glad You Asked.
And I'm Rebecca Bratton Weiss. Before we get into the interview, though, let's take a moment to thank our sponsors.
Glad You Asked is sponsored by the Claretian Missionaries. The USA-Canada province of the Claretian Missionaries tends to the religious and pastoral needs of vulnerable communities. As part of a global congregation of Catholic priests and brothers, Claretians uplift the dignity of all people, especially those who feel overlooked or forgotten. To find out more and get involved, please visit www.claretians.org.
For this episode of Glad You Asked, we decided to do something a little different, a crossover episode with the Just Politics podcast, which is a partnership between U.S. Catholic and the Network Lobby for Catholic Social Justice. So we invited Sister Eilis McCulloh, one of the hosts of Just Politics, to talk to us about healthcare in the United States and what the Catholic Church offers as guidance around this topic.
Eilis is a sister of the Humility of Mary. She currently serves as the grassroots education and organizing specialist at Network and is one of the hosts of the Just Politics podcast. Hi, Eilis.
Hey.
I think we've talked about doing a sort of crossover episode between Glad You Asked and Just Politics, probably for like a year or two now, right?
Easily, yeah.
So I am really excited that this is finally happening today.
Me too.
Yeah, this is such a great topic too, just the relevance of the moment that we're in, but also just in general, in terms of educating people about Catholic social teaching. So yeah, I guess to start, does the church have a teaching on healthcare? Does it consider healthcare a basic human right?
Yeah, so that is an excellent question, and there's kind of a couple different answers. But as I was preparing for this, I went back to something from Saint Pope John the 23rd in Pacem Terris from 1963, and in that he says that every human being has the right to life, bodily integrity, and to the means suitable for the proper development of life, including food, clothing, shelter, rest, and medical care. So he's laying it out that everyone has a right to access medical care. And for so long, our Catholic social teaching, our history of the church is based on the dignity of each human being. And in order to make sure that everyone has that dignity and can live into that dignity is the access of healthcare, of affordable healthcare, for every single person.
Yeah, so you started to do this already, but could you kind of connect the dots a little bit between this idea of healthcare as a right to the church's broader vision of human dignity and the common good?
Yeah, so time and time again, the U.S. Catholic bishops, Catholic sisters, the Catholic Health Association in the U.S. have continually said that every person has a right to adequate healthcare. When we talk about Catholic social teaching, we're talking about, how do people live fully? How do they have access to what they need to live fully? And so often what the Catholic Health Association, what Network Lobby for Catholic Social Justice, what we've always said is if people don't have access to that, even that most basic healthcare, how do they live fully? How do we ensure that people are healthy, that they are able to work, they are able to provide for their families, they are able to be productive members of their community? And so that kind of balance of the common good of making sure there's access to health care and that people have access to that is something that Catholic social teaching very much speaks about. And the Catholic Church has worked to, I would say, educate and share that understanding of healthcare with everyone.
Now, this is a topic that's got a certain kind of historical context around it because health insurance has not always existed. So the way in which this question would have been framed, 500 years ago, 1,000 years ago, would have been different. How has the church traditionally supported people's access to healthcare?
One of the things that I first thought of with that question is Catholic sisters and how for centuries, both here in the United States and across the world, so often it was the Catholic sisters responding to the healthcare needs, the medical needs of their own communities. Whether that was kind of nursing people back to life. My own community founded a hospital in Youngstown, Ohio that cared for railroad workers as they were coming through town, dealing with the influenza pandemics and things like that, opening birthing centers for women. And I think, before there was access to health insurance or access to health care, it was so often the Catholic sisters that really lived and served in that gap, caring for the people around them.
Yeah, I'm so glad you brought that up because I think that so many of the hospitals that still exist today were started by Catholic sisters. And healthcare in this country being what it is, not all of them are anymore, right? I think the hospital where I had my son was a Catholic hospital and has gone through like 3 different changes in ownership in the past 5 years, right? But yeah, I think that's a really important part of our history of our faith that we forget to talk about.
Right. And, I also think it's really tied to that, what Jesus did with the Sermon on the Mount, to caring for others, to caring for those who are sick, to those who are suffering. And sisters and hospital chaplains, medical professionals have made that a part of their own public ministry to saying, we provide care for all people, regardless of your social status, regardless of where you live in the city, regardless of who you are.
So, to set the stage for the conversation today a little bit, when people talk about universal healthcare, what do they mean?
So, this is such a broad ranging question. And I don't even think I'm going to be able to touch on it, even a tiny bit, because I asked some of my colleagues what they thought universal healthcare is. And it seems like everyone has a slightly different interpretation of it. But at its most basic level, I think universal healthcare is really ensuring that every single person, regardless of the jobs that they have or the means that they have, has access to quality healthcare services without facing financial hardship. With that, the quality healthcare and then the without enduring financial hardship being the 2 cornerstones of universal healthcare.
So, obviously, different countries are going to organize healthcare in different ways. Do we have any examples, even within our own country, of what universal healthcare could look like?
I think there's 2 really good answers to this, and one that I'll talk about more in depth because it's something I know much more intimately. But the first really good example of universal healthcare is the VA and the services that the VA provides across the country. But the one that I personally am very passionate about and really care about are federally funded healthcare clinics that are in cities and rural areas across the country that, in large part due to Medicaid funding, so they're places that are really hurting right now, but they are able to provide care to every single person that walks through their doors, whether or not they have health care. They do sliding scale fees to ensure that people have access to affordable health care. They often provide vision and services, dental clinics, immunization clinics for kids before they go back to school. They kind of are like that one-stop shop for healthcare services. And I know prior to coming to Washington, D.C., my primary care was at a federally funded healthcare clinic in Cleveland, Ohio. And they served every single person in my neighborhood. That was our primary care facility. And there were phenomenal doctors and physician assistants and nurses, midwives there who really believed that healthcare was part of the community and would go to the ends of the earth for the patients they served.
So how do programs like Medicare and Medicaid fit into this picture?
So, so often I think about the people that I know in my own lives and my own family who work full-time jobs or stitched together a couple jobs and don't have access to healthcare, or for whatever reason have ended up on hard times and are not working. And Medicaid is the health insurance that allows their kids, especially the kids, to have access to healthcare, to those, regular well child visits that are able to catch so many things growing up. It's about preventative medicine. And then in terms of Medicare, on the flip side, for older adults, so many of our elders in our community, so many sisters rely on Medicare to receive their healthcare funding. I know that over the summer in June, we had a big Sisters Speak Out event in Washington, D.C. And Sister Mary Haddad from the Catholic Health Association reminded us that if we lose Medicare, there's going to be more than 50% of the sisters, the Catholic sisters in the United States, who will lose access to healthcare, affordable healthcare. And as a sister, I'm saying so many of us have resources. But, thinking about our grandparents, our great aunts and uncles, our neighbors, nursing homes that provide safe havens for so many people, will lose all of that because Medicare is what keeps those things open. So we'll be looking at an entire population that will lose access to not just healthcare, but so often probably to housing as well if nursing homes are forced to close.
Yeah, and it just seems incomprehensible that this would be happening in a nation as wealthy as we are. So, kind of to take a step back, looking at the global picture, what are some examples of healthcare systems in other places that could potentially be a model? Are there any that kind of stand out as being exceptionally good?
I can speak to, so often we hear about like access to universal healthcare is like watering down what healthcare looks like or what you're able to get. And I was just talking to one of my best friends that I grew up with who recently moved back home to the UK. And, sure enough, about, 2 or 3 months after she got back, she had to go to the doctor. She got sick and needed healthcare. And it was her first experience since she was like 4 years old with healthcare in the UK. And she talked to me about how she was worried because she had heard the kind of tropes about she wouldn't have access. She wouldn't see a good doctor. How do you establish care? Things like that. And she said it was one of the smoothest processes. It looks different than what we're used to. She said, where she is, she's like, I won't pick a primary care doctor, but I will still have access to everything that I need. I will still have all my charts. And she talked about how the healthcare system there is much more kind of connected. It's not just about treating that one problem. It's about making sure you have access to the preventative care, to seeing it all in a much more holistic point of view.
So for the next questions, we were kind of playing devil's advocate because you do hear these arguments is like, well, if we did this, then we'd have to wait 6 years to get a knee replacement or something.
Yeah.
You hear these kind of catastrophic stories, right? And so one of the things that people argue is that it would just healthcare overall is expensive. And if we don't pay private insurance, like how is the medical system as a whole going to afford to be able to pay for everyone's care? And so can you speak to that argument and kind of what the impact might be on access and affordability, access to doctors, to specialists, if we did implement kind of government-funded healthcare more broadly?
So I'm going to take a step back first and then answer that. So, and kind of do like imagine if. So right now we think about healthcare in very urban areas. I think about in rural areas as well. And so often the ER has become the primary care center for so many people for a variety of reasons. And many hospitals will still treat people who don't have access to healthcare, through whatever financial program they might have. And then Medicaid or Medicare pays that hospital back if the individual has one of those programs. But you think about if healthcare is to change in the US, more people will lose their healthcare because they will not be able to pay ACA insurance premiums. Due to things like work requirements, people will be kicked off of Medicaid and other reasons as well. And so we're going to have this larger population of uninsured folks in the country who are still seeking care at their local emergency room, who are also still going to doctors and are not able to pay for those, whether it's through insurance or out of pocket. So the costs for the rest of us are going to go up. For those of us that have health insurance through our employers, or through whatever else, we're going to see an increase in the cost of healthcare, which doesn't make sense. I mean, it's going to leave everyone mad. We already pay a lot for healthcare. I was looking at statistics. The U.S. is at the top of similarly situated countries for the cost of healthcare per person. So that is just going to continue to go up and up. And as a result, we're going to see so many more people who are not accessing healthcare until it's too late because they can't afford it, because they're afraid they're going to be turned away for all different reasons. So, and I think going back to your question, what if we imagined a world where we do have universal healthcare here in the US? Maybe the wait looks a little different. Maybe the way we access healthcare looks a little different, but we all have the means to access it as we need. We'll be able to see access to preventative or like regular yearly checkups go up, to preventative care. People are going to be healthier in the long run. You think about in school, kids in school, if kids are going to school healthy, they're able to focus more in school. If parents are healthy, they're able to work, put food on the table. And so it takes away more like the stressors of daily life in the US. And I think as well, it's not going to affect the quality of healthcare. It's going to make things much more interconnected instead of going to, this doctor and then this doctor, and then you end up maybe in assisted living or a nursing home and they don't have access to anything else that you've done in the past.
Yeah, I think something else that you mentioned, the cost, but I think something else that is interrelated is the access to, right? Like I go to a clinic that's a neighborhood clinic. I pay for that for my healthcare with my employer health insurance, but a large proportion of their patients pay with Medicare, Medicaid. And so if those programs go away, that clinic folds, now I can no longer find a doctor. And so I do think like we forget that it's not like even those of us with employer sponsored healthcare will be affected if these programs go away, because access is another issue.
Exactly. And we're already seeing that. My dad was recently in the emergency room a couple weeks ago, and he said, he waited 9 hours to see a doctor. And they didn't have enough beds in the ER for the number of people coming in. And he said, and people were coming in with colds, with flus, with things that a regular doctor's appointment would handle, possibly. There's always, something that comes up, or urgent care, things like that. But he said, I was able to see how much of a shift there has been in healthcare. And part of it is a lot of the local, where he lives, some of the local doctor's offices have already closed in anticipation of what is to come. And that's changing that whole dynamic that you just talked about.
So another argument that people bring up is this idea that because drugs are expensive to develop and we need to pay for that research, if other countries aren't paying so much for drug costs and someone has to fund that research, and it's got to be the United States, so we need to have people paying a lot for our health insurance. Is that a valid argument?
No, it's not. Simply put, the cost of drugs in the US has skyrocketed for years. It is the age-old argument from both sides of the aisle. Like, how do we lower the cost of drugs in this country? What insurance companies cover the cost of this drug versus this generic thing of the same piece? I don't have an answer for, what is the fix. It should be simple to say, yeah, we have to pay for the research, whatever that might look like, but shouldn't we make it, more affordable? If everyone's accessing the medicine, you'd still be getting your however much it is. But it's again a question of the haves and have not. Who has access to the prescription drugs, who does not? Who is reaping the benefits of this increased cost? It's the manufacturers. At Network, we always say it's the billionaires, the people who are just, raking in that money. And what would it look like to create, for lack of a universal cost system where everywhere you pay, it's the same amount? I lived in Guatemala for a little while and had to get a prescription there, had to go to the doctor there. And the prescriptions were the same thing I got here in the States. And they were not even, a tenth of the cost of what it would be. And so I think there's a lot of ways for us to look at how do we develop those drugs, how do we do the research on them, and how do we make them affordable for all people.
So, given all of everything we've been talking about, why do you think that so many people in the United States are so resistant to the idea of some sort of universal healthcare?
I think it really boggles my mind, but I think it comes down to this idea that so often here in the US, we don't live out of a place of abundance or the common good. We live out of a mindset of scarcity. And that when we live out of that mindset of scarcity, we're saying there is only enough for me. Or because I worked and I earned this, need to have this access to healthcare immediately. Or I want to be able to pay for the top doctor there is. But if we lived out of the idea of abundance, that if we all had equal access to healthcare, we could all thrive or have the potential to thrive in the United States. We'd have the opportunity to take care of each other. But there's something about that idea that so many people are like, no, you need to be deserving of receiving that level of care. So to me, I really think it's this notion, this mindset of kind of that haves and have not that has plagued our country for so long. And in my work at Network, in the work of my community, it's how are we creating a world where everyone has what they need. In my community, we say, how are we bringing more abundant life to all people? And to getting people to realize that everyone deserves that same thing.
Yeah, it's so strange how even when people are presented with the arguments that it's actually cheaper to do it the way other countries do it. Or actually, in other countries, people can see the doctor right away. My sister lives in London, and yeah, she does not have long wait times. And I'll say, well, okay, here in the United States, we get long wait times, and then we get hit with a really big bill. Isn't that better? Oh, and it's just so strange that people will still just be like, no, we can't do it. We can't do it. But we have seen successful movements toward healthcare improvements in the past. There's the ACA, earlier, the creation of Medicare. What did these successes and the movements to create them teach us about what it takes to expand healthcare access and to improve it for people?
I think about, with the ACA, with that piece, it took everyone coming together. It took our elected leaders coming together across the aisle. I at Network, we work on healthcare out of the place of like the storied nuns letter that got the ACA across the finish line. And what that meant when there were so many factions around healthcare within the Catholic Church. And what it meant for us as sisters to say, no, like healthcare is a basic right. The ACA will improve the lives of everyone. And it took like one courageous person who was willing to step out and say, this is right. My party might not agree with me. Maybe it's my church doesn't agree with me, or my, whatever group I'm a part of. But this is right. And I think about when that passed, I was serving at a Catholic worker in Youngstown, Ohio, and we were listening to the final vote on a radio. And the sister that was there, Sister Ann, and I remember her like triumphantly like shouting because she had witnessed the lack of healthcare in the city and what that was. And for her to know that, with the passage of the ACA, so many of the guests who came for meals at the Catholic Worker House could access healthcare much more easily. And it was a much bigger picture. Then it helped the hospitals. It helped doctors' offices, kind of all around. And I think that each time we've come up against a fight for healthcare, it's taken that same thing, that courageous person to speak out and say, no, this is right. I know I'm really hoping that in Pope Leo's recent document in Dilexite, he speaks about healthcare and it being a universal right. He speaks about the Catholic sisters who have run hospitals. And so I'm hoping that message really kind of continues and gives a needed boost as we're once again staring down a fight around healthcare.
So at Just Politics, and then also, of course, at Network, the whole purpose is to kind of place these political issues in light of our faith. And so I don't know what the question is here beyond to ask you to reflect on what it means to advocate for healthcare access, not just as a political social issue, but also something that we are called to do because of what we believe.
I think as a Catholic sister, to care about healthcare is to care about my neighbor at the core of it. It's to love, we always talk about this like big kind of nebulous idea of to love your neighbor as yourself, to feed the hungry, clothe the naked, all of that. And that is healthcare. If I can access healthcare, if I can go to the doctor, don't I want the person next to me to do the same? Don't I want them to have that same opportunity to receive preventative healthcare, to address a worry or a need that they might have in terms of healthcare without seeking this, medical debt that wreaks havoc on their whole lives? And so it's, for me, it's not even a political issue. It's a moral issue. It's an issue of faith. It's an issue of how I understand the nature of God, how I understand what it means to care for one another. And that, as a Humility of Mary sister, is to see to really stand on the shoulders of the sisters in my community who for centuries have provided healthcare, have cared for the people that no one wanted else would. that's what I think we're all called to do.
There's so much just anger and frustration and heartbreak over this issue in the United States. And, you see so many stories over and over and over again of lives ruined and people losing their housing. There was the Luigi story kind of really brought everything out into the open. And so, the question is, what do we do about it? How does the network lobby approach this question? How do we organize around this issue?
So I think kind of two things, or maybe three things right now. One of the things we've been doing for the better part of this year is we have posters that people can carry at rallies. That one says expanding Medicare is holy work. And then Catholics for Medicaid and SNAP, and Catholics for Healthcare for All. We encourage people to print those and take those to events to show that this is a Catholic, big C Catholic issue, that access to healthcare is an issue we need to care about. We recently just delivered about a week and a half ago a letter signed by over 2,400 Catholic sisters and associates to members of Congress, calling for them to protect Medicaid in these shutdown negotiations that don't sacrifice the healthcare of millions and millions of people during this time. We have sign-on letters that we do, but one of the most important things I think that we do, and I'm probably saying this as on our grassroots mobilization team, so I work with people across the country, is learning what's happening where we're seeing all these rural hospitals closing or urban hospitals closing. And what does a lack of access to healthcare mean for communities? And how do we take those stories and the lives of those people who are being most impacted and share them with our government relations team, who can share them with members of Congress and say, this is what is happening when you are denying healthcare to millions of people. This is how communities are being impacted. This is how many people are losing jobs, and on down the line. So it's really making sure that we are able to tell the full story of what happens when an individual loses access to healthcare or when a community loses access to healthcare. And we always say, we invite people to come join us, share your stories with us, share our action alerts, our letters to the editor, educate the people in your own community about what's happening.
So right now, as we're talking, the government is shut down in large part because of issues around healthcare funding. People are facing the extreme price increases in their health insurance. People are losing access to their doctors, right? The system feels so broken right now. What gives you hope or energy given where we are right now?
I have to say it's the people on the ground who are carrying on the fight in their own communities. Being here in Washington, D.C., it so often feels like everything's broken. And, people who have been furloughed, are moving out of my apartment building, or, you don't see as many people on the streets. The city is hurting. And that's just here. And knowing that that's everywhere is really heavy. But then I see people who go out and protest and, speak out and saying, no, this is not happening in my name. As a person of faith, I'm not going to let this happen. I'm not going to let you decimate my entire community. And those people who every single day are speaking out give me hope. It's also to give a little shout out to the Sisters of Charity of New York, whose social media game has been excellent, but who are talking about healthcare. And they ran hospitals. They cared for the least of these, for people who were dying of AIDS. And they showed us what dignity looks like in healthcare. So it's all of those people who just really keep everything going when everything seems so bad.
We always end these conversations by asking our guests if listeners take away just one thing from this episode, what would you want it to be?
I think it's what my favorite sign at Network is right now is expanding Medicaid is holy work. That protecting healthcare, ensuring that everyone has access to affordable and quality healthcare is holy work and is what we're called to do.
Thanks so much, Eilis.
You're welcome.
So, was there anything that surprised you in our conversation with Eilis?
Oh, that's a good question. I'm really glad that she pointed out the historical role that sisters have played in healthcare and healthcare access. I think that is a story that we forget. Just like how large a role Catholics, especially women religious, had to play in healthcare in our country and ensuring access to healthcare in our country. I think there's this whole really important narrative. And we know that a lot of hospitals are Catholic, right, or have Catholic roots, but I think the true significance of that and what that means and what that says about our faith is sometimes lost in how we talk about healthcare. So I'm really glad she brought that up.
Yeah, that interested me because it was almost like I had to be reminded. The hospital closest to us is Catholic owned, and one reason I had to be reminded was perhaps that I don't see Catholic social teaching reflected in what is experienced at that hospital. And it seems to me that we have this amazing tradition in terms of not just what the Catholic Church teaches, but what Catholics, especially religious sisters, have done. And are we losing that? Is that something? I mean, I've talked before about how in the Middle Ages, like you had these great monastic houses that offered so much to their communities, like food and shelter. We've talked about sanctuary. So, in kind of the same way, as the Catholic Church kind of figures out its place in the modern world, how can the Catholic Church recapture that tradition of making those teachings, making those values really present? So, so if I were to walk into my hospital, I would be like, oh yes, this is clearly a Catholic hospital. I can tell because of the affordability and the respect for the dignity of the person.
Yeah, I think so much of the conversation around Catholic hospitals is around, when they get sold to a larger hospital conglomerate or whatever you call these big companies, right? And I think then the discussion is around finance and shrinking communities and shrinking resources. But there is something there about what are we losing in terms of our faith and the teachings of our faith? And then are we letting this important part of Catholic social teaching also kind of fall by the wayside in all of this conversation around finances and the necessity of selling hospital systems?
Yeah, and I find it a little disappointing when the discourse around Catholic healthcare is really reduced to, well, should Catholic healthcare services be making this particular controversial treatment available? And that's just such a tiny, tiny little part of what the Catholic Church has to say about healthcare. It's like we've just forgotten everything about the dignity of the person, everything about how everyone should have access to good health care, that is something the church teaches as a right, and we're just zeroing in on a few areas of care where there is some disagreement about what should or shouldn't be available.
Speaking about the dignity of the human person, Eilish had this line about the mentality of scarcity, and that our country, healthcare is such a debate because there's this sense of, well, if someone else has access, that means that there's less resources for me. And she talked about kind of switching to a more mentality of abundance. And for her to kind of name that as the reason why some of these debates are going on, and to kind of bring it back to this underlying worldview, that was something that I found both surprising but also really helpful and really meaningful, and kind of how I start to piece out, well, yeah, why don't you want everyone? Like, why can't we all agree that everyone should have access to affordable healthcare? Like, why is this a thing? So I really appreciated her bringing that up.
Yeah, I thought that really stood out all the more when you consider the fact that of the nations that were included in that study, when you think, oh, well, the United States has the worst healthcare, therefore we're probably not investing that much in it. Well, actually, we are. The expensiveness of healthcare in the United States for the individual does not translate into affordability in terms of gross domestic product. We pay probably 18% more, I think, is what it said. So, we're paying for it across the board. Therefore, it should be abundant. But as you say, it should be abundant anyway. We should shift our thinking.
So yeah, I think that gets to the next question, right? Which is there anything that you wished we could have spent more time on?
I mean, I like getting into policy a lot, and I think that I'm always looking to see, on one hand, there's this argument, which is that this is what we should do, and should do it regardless of whether it's convenient, regardless of whether it's cheap, regardless of whether it's easy. But I'm always kind of curious to see, well, if we did this, how hard would it be? How does it work out in other countries? And I would have liked to have had a little bit more time to discuss that.
That's funny because I was thinking almost the opposite, that there was a lot of kind of policy laid out, and I really wanted to kind of dive into the theology of it. Things like human dignity and the importance of even preventative care, things like that tie those together a little more concretely.
Yeah, that's a great point. I wonder if this has to do with the different types of people we end up having conversations with, because I feel like I'm always arguing with people and being like, no, look, this is going to work. But it might also just be your theological mind. I mean, what would you say about kind of the theology of preventative care? I'm kind of intrigued by this.
Oh, it's just a nut there. Like, I haven't had time to think it out, but I think there's something in there about, if we believe in human dignity and that every life has value, part of that is ensuring that every life is cared for. And we talk about beginning of life and end of life issues when we talk about pro-life. But I don't know that I've ever heard anyone talk about caring for the lives we have or ensuring that everyone has the resources to take care of the lives they have. It just seems to dovetail in there really well.
Yeah, it seems really actually kind of ludicrous to claim to be pro-life and then say, okay, but that child who's 12 years old who desperately needs care, well, too bad. I guess their parents can't provide it. They're just going to have to die. Or, oh, well, that older person can't be seen in a care home. Well, I guess they're just going to have to be without a home at all. Like, what on earth? It just doesn't translate at all.
I guess I just still really don't understand the argument of why health insurance shouldn't be affordable. Like, why should families have to pay thousands of dollars a month for basic health care? And why is this something that we've gotten to be okay with?
I mean, I think that we've been really flooded with propaganda. I think that the reality is that as soon as you start looking at both, whether you're looking at the morality and the theology, or if you're looking at the data on policy, it works so much better to have one of the systems that's functioning pretty well in all of the other developed countries. We're the only developed country that doesn't have some form of universal health care access. We are the only one that expects families to pay this much out of pocket. And there's something really sinister about the idea that we've been flooded with propaganda telling us it has to be this way. I would like to I would like to counter that with a flood of the truth. It should be on all of the airwaves.
I mean, so take the argument we talked about in the interview with like, oh, well, people have to wait a long time, which I know Alicia was like, well, that's not really true, right? But even so, even if you have to wait a long time, how is that more morally defensible than just children not having care at all?
Besides which, here, we not only have to wait a long time, we sometimes wait forever because we can't get there at all.
Right. Or, I mean, just, you mentioned this in the introduction, but medical access remains a huge problem. There's, where I live, when I moved here a few years ago, there is a huge shortage of primary care doctors. I had to wait a year to make an appointment with someone We were lucky enough that we found a pediatrician for my son who was coming back from maternity leave and happened to have openings, but we had called multiple pediatricians who weren't accepting new patients. So we're not doing well anyway.
No, we're really not. And I think about all of the people who don't go get preventative care because either they don't have insurance or it's too difficult for them to find someone to give them the preventative care, and they're going to still get billed. That's the crazy thing is that, you have insurance, but you're still going to get a bill. You have insurance and you still may have to take out a loan to cover stuff. And it's just it's a system that almost seems set up to fail, in which people are not going to get care, so they get sicker and sicker. So when they do finally go in, it's going to be exorbitant and it's probably not going to help them anyway. It seems like the system's trying to impoverish us, make us miserable, and kill us, which is the exact opposite of what it should be doing.
So on that note, what's the takeaway here, Rebecca? What's your sermon you would preach?
Can I do a summon to revolution instead of a sermon? Jesus would like that, wouldn't he? No, but I think my sermon would be that I think we need to take more seriously the reality that Jesus healed people and that Jesus called his followers to do the same. We don't have access to miraculous power, but we have access to all of the resources of creation and ingenuity that God has made part of creation. And I think we need to take very seriously that if we are not creating a system that cares for all people, that cares for the health of all people, we are failing to follow Jesus.
I keep thinking about the fact that most of the time when Jesus heals someone complains. Right? It happens on the Sabbath. Like, oh, this person wasn't supposed to be touching Jesus, right? And he does it anyway. And I think that goes to your point more than a unique sermon, but I just keep thinking about what would Jesus do in the face of our healthcare system. I guess if I had to do a different topic, I would think about access and equity, what equity means. Look at maybe the parable of the vineyard and how fairness and equity looks different for different people. And that when we talk about healthcare access or payment or the availability of doctors, equity might look different for everyone, and that's how it should be.
And that's our show. Thanks again for joining us for Glad You Asked. If you enjoyed the episode, please tell your friends about the podcast, or leave us a review or rating on whatever podcast platform you listen to. It helps more people find our podcast.
Do you have a question you'd like to hear answered on our show? Email us at editors@uscatholic.org. Please join us next week for a special 3-part series about Mary, the Mother of Jesus.
Before we wrap up, we're excited to share a new ministry for immigrants and anyone impacted by forced migration. This ministry is led by our sponsors, the Claretian Missionaries. Somos, Together We Are Faith, Hope, and Strength, is a social media campaign offering spiritual care and resources for immigrants on their journey. Find us on TikTok, Instagram, Facebook, and YouTube. Help us spread the word and support the migrant community. To learn more, visit claretians.org.
Glad You Asked is hosted by me, Emily Santa, along with Rebecca Bratton-Weiss. We're produced by Stephanie Clary and Joki Mercuria, with sound engineering by Nathaniel Hunter and art by Megan Avery.